Okay, can I remind members that all committee meetings held in public session are recorded and that mobile phones and Blackberries interfere with the recording equipment? And can I ask members to switch off their phones, please? Or at the very least, get them off the benches. They're not buzzing. Okay, we move on to item 3, which is chairperson's business. And can I advise members that in advance of the committee's visit to Scotland, it would be useful to seek an update from the department on progress against the recommendations in the committee's report on health inequalities, which was published in January 2013. Are members content to seek this information?
Great.
Can I also advise members that the next stakeholder event has been arranged for Wednesday the 20th of May in the Long Gallery? Are members content to hold the event?
Yep. Great.
Okay, item 4 is draft minutes of the meeting on Wednesday the 18th of February 2015. Can I refer members to the draft minutes of this meeting at page 47? Are members content with the minutes?
Great.
Okay. Okay, if we could move on to item 5, which is the Marshall report on child sexual exploitation, and we're having a departmental briefing. Can I refer members then to page 53 of their packs? Okay, you're all very welcome. Can I welcome Eilish McDaniel and Bernie McNally and Martin Quinn. I'm reading it off here because I can't actually see that far without my glasses on. It's a bit of a nightmare. Okay, you are very welcome, and can I invite you to make any presentation you might have for the committee?
Thank you, Chair. Thanks for the opportunity to come here today to discuss the Department's response to the recommendations contained in the Marshall Inquiry report into child sexual exploitation in Northern Ireland. I'm joined today by Bernie McNally and Martin Quinn. Bernie's been appointed by the Minister to drive forward implementation of the Marshall recommendations made for the HSE, in particular those made for the HSEB, trusts and the Public Health Agency. She'll also assist with the implementation of cross-departmental recommendations by offering advice and providing a challenge function. Martin is a safeguarding and commissioning lead in the Health and Social Care Board. Bernie will lead the implementation group, which has been established to deliver a coordinated and comprehensive response by the HSE to the Marshall recommendations. The implementation group, led by Bernie, is one of a number of structures established to implement the Marshall recommendations. It will report to a department-led response team, which the Health and Social Care Board, the Public Health Agency, trusts, the RQIA and the SBNI are all represented. In addition, the Ministers of Justice, Education and Minister Wells have agreed to the establishment of a senior officials group which will oversee implementation of the cross-departmental recommendations. All groups have met at least once since the publication of the Marshall report and will continue to meet and report progress on a quarterly basis. Reports on progress will be made to Ministers on a 6-monthly basis, and it's intended that departments will provide updates to their respective Assembly committees every 6 months. In advance of today's session, members were provided with a written update on progress made to date. 9 of the 17 key recommendations and 29 of the 60 supporting recommendations were made for the HSE, the Department, the Board and the Trusts. 2 of the 9 key recommendations are to be progressed jointly with the Department of Justice and or the Department of Education. I'm not proposing to repeat what was contained in the written update, but to summarise. Minister Wells has accepted all of the Marshall recommendations. Initially, those which are cross-departmental were accepted in principle. I can now confirm that all 3 departments are committed to working together to advance those recommendations made for them. The ownership of some recommendations is transferred. For example, the Department has transferred responsibility for recommendations which are operational in nature to the Health and Social Care Board, or has asked the Health and Social Care Board to lead on some recommendations made for trusts to ensure that we achieve a consistent response across the region. We've also asked the SBNI to lead on the development of a public health campaign assisted by the PHA and to lead on a number of recommendations which Professor Marshall made for all agencies. There are a number of recommendations which we consider are complete and a number of others which we've made significant progress on. in the main because work was already underway when Professor Marshall reported. Action has also been taken in connection with a number of recommendations since the publication of the Marshall report. In terms of next steps, Minister Wells has asked for a comprehensive and fully costed implementation plan by the end of March. We're in the process of developing that plan, and Bernie can describe the development process for you if you wish. The committee will receive a copy of the implementation plan after the Minister has had the opportunity to consider it in detail. The plan will set out what will be done, by whom and by when. Costing is important, and the availability of funding in difficult financial circumstances may require us to revise the plan, in particular the timescales for delivery. We have estimated that the cost of implementation of the HSE recommendations in 15-16 will be around £1.5 million. And I must emphasise that it's only an estimate at this stage, and it doesn't include the cost of implementing the cross-departmental recommendations. A separate exercise will be undertaken to cost and plan implementation of the recommendations owned jointly by the Department of Health, Justice and Education. Not all recommendations will require new money to implement. For example, the development of guidance, standards, regulations, which will be delivered by way of the reprioritisation of existing staff resource. Nor are changes in practice likely to require additional funding. Indeed, some changes in practice may lead to greater efficiencies, for example, notification arrangements in the event that a child goes missing. There are, however, a number of recommendations which will clearly require additional funding, in particular those which promote service developments or service enhancements. Chief among them are the creation of safe spaces, the development of a multi-agency safeguarding hub model for Northern Ireland, or the provision of additional support services for adults who were abused as children. Additional training is also likely to require additional funding, although again this could be delivered by making CSE training a priority over other training needs. Members are aware that one key recommendation relates to the development of a public health campaign linked to CSE, and we have asked the SBNI to take this forward with the support of the PHA. This will require new money, and some funding totalling around £250,000 has been made available to the SBNI in year. It will cover the cost of an educational play and the development of 2 apps, one for professionals, the other for children and young people, providing information on CSE and child safeguarding more generally. Unfortunately, we have run into some difficulty with a multimedia campaign because the selected advertising agency has in the last week advised that it is unable to deliver the campaign in this financial year. While an in-year funding opportunity may have been lost, we will work with other departments to identify or avail of other funding opportunities in 15-16. On a more positive note, over 40 schools, including special schools, have expressed an interest in the educational play. Schools in some of the most vulnerable areas will be given priority. In addition, work on the development of the 2 apps is progressing well. One thing that was absent from the paper provided to members was information on work already taken forward or being taken forward by the Health and Social Care Board to respond to CSE or to child abuse or child safeguarding challenges more generally. And Martin will be able to provide you with greater detail on the work of the HSCB to date, but headline activity includes a recent review of regional guidance on police involvement in residential units, which also deals with safeguarding of children missing from home and foster care. And a draft of the guidance is issued for targeted consultation, including consultation with children and young people, which Professor Marshall recommended, and children's advocacy organisations. This is directly related to the delivery of Marshall supporting recommendation 14. An assessment of the appropriateness of existing unregulated placements to ensure that the assessment of young people in those placements are being met. This is directly related to the delivery of supporting recommendation 22. A review of protecting looked after children guidance, which is currently with the Children's Services Improvement Board for approval and relates to the delivery of supporting recommendation 56. The development of region-wide guidance on current control as required by supporting recommendation 26, and a review of the process of recording episodes of looked after children who go missing. A new recording system will be implemented from April 2015. Finally, additional funding of more than £500,000 has been made available to trusts to help them respond to CSE. The additional funding will strengthen the provision of therapeutic support services and also support the appointment of senior social workers for CSE in all 5 trusts and a regional coordinator who will be located in the South Eastern Trust, or who is located in the South Eastern Trust. The Board has also increased funding for the Bernardo Safe Choices project, which will receive around £200,000 in 15-16. What I've tried to do today for you is to demonstrate that work is ongoing to deliver against the Marshall recommendations, all of which have been accepted by Minister Wells, that we have arrangements in place to ensure coordinated delivery across the HSE and across departments, and that we're committed to keeping the committee fully informed of progress through to full implementation. I've highlighted that ongoing financial difficulties will present us with some challenges, particularly in relation to the delivery of recommendations which require new money. The most challenging of the recommendations to deliver will be those associated with either service development or service enhancement, including the provision of new or additional support services for adults who were abused as children, and that is assuming that we establish that new or additional services are actually required. Thank you, members, for your time, and we're very happy to take any questions that you might have.
Okay, thank you very much. Bernie or Martin, have you anything to add, or
No, not
at this stage? Okay. If I could just go back then to the public health campaign, which I think is a fabulous idea, especially the educational, the play and the apps. Brilliant idea. I think that's the way of getting to our young people and getting the message out to our young people, because on a more of a personal level, as the chair of the Sexual Health Committee, I don't think we do enough within our schools to highlight issues around relationships and around abuse and things like that. So you had said with the multimedia campaign there's an issue. Is that for what period, or, within the year, what period is that?
We had allocated money, around £200,000, Chair, to develop that campaign in year and to run the campaign early next year. But the advertising company, as of just last week, indicated that it wouldn't be able to deliver within this financial year, which means that the money that we have allocated in this financial year is now lost to us. So a bid or money will need to be sought next year to do it. I'm not saying that it won't be done, and we will just have to find money to do it in the next financial year. And CSE is actually something that we have highlighted as a pressure for next year, and the implementation of Marshall recommendations in particular has been highlighted as a pressure, as will be any work that comes out of the thematic review currently being undertaken by the SBNI, which you know is also related to child sexual exploitation.
Okay, it's just a bit of a shame because the money was available, and there's so many other things that money isn't available for, and it's a shame that we weren't able to get that progressed, because I think it's an essential part, definitely, to highlight these issues. Also want to look at the work currently underway. Have we any issues or any problems that are going to arise from any of those?
No, I mean, I think we've made progress on a number of issues, and I've said in my opening statement that some of that was by virtue of the fact that this was work that was already underway prior to the publication of the Marshall report. So, for example, we had started the development of a number of safeguarding policies, one for children, one for adults, and they were recommendations made by Professor Marshall. We'd also started some work on the development of guidance related to information sharing, again, another Marshall recommendation. The board has undertaken a fairly significant body of work and has made great progress, and I don't think we're encountering any difficulties with any of that to date. Do you want to add anything, Martin?
No, most of the things that we're actually progressing have received fairly positive feedback, to be honest with you, because I think they're more robust than what went before. They're more prescriptive, they're more detailed, they're more directional, which I think is a positive thing, which will enhance consistency across the 5 years as much as anything else. But no, I'm not encountering any major. I mean, there's minor tweaks here and there, things in terms of feedback, but nothing significant at this stage that I can determine.
Okay, I'm encouraged with that. Members, have members any questions that they want to ask? Kieran? Sorry.
Yeah, Chair, thanks very much, and thanks very much for your presentation. I must say, you whizzed through it, and you probably going to answer the question that I've got, and that is it possible for this committee to be provided with an action plan as you go along, which in particular includes the timescales of implementation, of each of the accepted recommendations? I think you mentioned that, but will the committee get that sort of plan so that we know exactly how things is going?
Absolutely. There will be an implementation plan developed by the end of March this year, and the Minister has asked for it to be developed at that stage. Once the Minister's had the opportunity to consider the plan, in particular the costs associated with delivering the plan, then we have given members a commitment that we will make a copy of that plan available to you, and then of course we will report on progress against the plan through to full implementation.
The other thing, the next question is the resource implications. You know, I mean, and you give us some figures there. I think you said 1.5 million. Is that for the? Was that the figure you gave us? 1.5 million.
We have estimated that it will cost 1.5 million to implement in 15-16. So the plan is likely to span a longer time frame than that. I have also made the point today that that is only an estimate at this stage, and I think when Bernie has undertaken her work, identified exactly how we're going to deliver against some of the recommendations and costed those, we can be a bit more precise about what we actually need, not only next year, but in future years.
Yeah, well, I mean, I'm sure you can understand the issue which we're talking about is so important that it would be crucial, it would be critical that the implementation plan is resourced sufficiently and properly, that it wouldn't be falling down somewhere along the line, you know, and then somebody come by, oh, we couldn't do that because we didn't have the resources to do it.
No, I mean, I flagged up that we have identified it as a pressure already, and I'm not saying that it won't be without its challenges to secure the necessary funding, but one of the things we might need to do, for example, is alter our timeframes for delivery. So it might take us longer to deliver some recommendations than we might otherwise have liked. But there are things that will become more evident to us when Bernie has done her work and produced the plan with its costs by the end of March, which is not that far away.
Yeah, and finally, Chair, you mentioned the figure of, I think it was £500,000 for the 5 trusts. Was that, you can say that?
Yeah.
Is that evenly spread? Is that £1 million for each trust? No, sorry.
500,000.
500,000, yeah, sorry.
Do you want to add to that, Mark?
It's roughly 100,000 for each trust, with the exception of the South Eastern Trust. They've got slightly more because that's where the regional coordinator is based, and we've given a bit of extra money to support that. But roughly, yeah, they're all equally split.
Okay. That's grand. Thanks, Chair.
Okay, Kieran, thank you. Joanne?
Thanks, Chair. What I was going to ask has largely been covered, and like the Chair, I would be concerned that the campaign, which was instrumental, I feel, to get this kicked off, would not be delivered until 2016. Could you have foreseen problems or anything? I think 300,000 had to be handed back. You couldn't utilise that?
It's been done through, it was intended to be done through an advertising agency, which the PHA uses to do other work linked to the work of the PHA. Unfortunately, it just cannot be done within this financial year. So the funding that we had earmarked for that purpose, unfortunately, will be lost to us. The only thing that I can say is that it was beyond our control, and the intention is to pick that up again next year. I'm currently in the process of trying to identify money quickly so that we can resurrect that project.
Why was it beyond your control then? Was that money reallocated, or that had been set aside? Or I just got the impression, just from your initial briefing, that it was something to do with the advertising agency. So it was.
The advertising agency just cannot deliver in this financial year. So money that we don't use in this financial year, unfortunately, we just have to give up. And the really unfortunate thing I think about it too was it was money that had been made available by a number of different departments. But I'm in the process of trying to generate the required funding for next year and to get that project up and running as quickly as possible.
We don't have a time scale yet. You said early 2016.
It would be early in the next financial year.
With those proposals and with that. Right, that is a missed opportunity, I feel too, like the Chair. Kieran has asked, I was going to touch on, you talked about additional funding with the 5 trusts, and that's Kieran, you've answered Kieran's question to that. Bernardo's, are they delivering that for you in 2016?
Bernardo's delivers a Safe Choices service. That's the name of the service, and the board has indicated that I think you've uplifted the funding for
We've
Bernardo's,
uplifted the
is that
funding
right?
because the programme has been funded on various parts by Bernardo's itself, Comic Relief, and partly funded by the board. The Comic Relief funding ended and there was a shortfall, so the board have decided to uplift its funding contribution to sustain the programme. It will be subject to usual procurement rules and regulations as we move into 15-16.
Oh no, I'm just given their expertise and their experience with it. You know, again, can you take us through how this will be delivered through in timescales through the trusts? I think if someone appointed already, did you send the South Eastern Trust or?
All the staff were appointed. Some of these staff were part-time under Operation Oil with the police and located there. That came to an end. What we've done is extended that funding and uplifted it to full-time. So these people are by and large the people who are working in Operation Oil. So they have a lot of expertise and competence already. So it's maintaining that within the trust and then expanding that out as somebody as a resource for staff within the trust to access in relation to CNC.
So that will be available across all the trusts?
That is available as we speak at the moment.
Okay, and there's going to be no stoppage, you know, with advertising campaign, the funding, funding isn't going to be an issue, this will continue?
It's not recurrent fund at this stage, it's non-recurrent, so I can't speak beyond that at this stage, but our intention is to keep that at this stage. At this stage, I don't know if the fund will be available beyond that.
Given, like Kieran, how important an issue it is, I think it's imperative that it does. Okay, thank you. Thanks, Chair.
Thank you. Any other members wish to come in at this stage?
Yeah, can I come back on that? Again, explain exactly why or how that money was lost, the advertising money. I mean, it seems to me that there are more companies out there that could be used. Why weren't they?
If you consider that Professor Marshall reported in November of last year, so it wasn't a long time ago. Then we've worked in the intervening period with the SBNI to develop a number of proposals linked to raising awareness of child sexual exploitation. The APPS is one of those proposals, or was one of those proposals. The educational play was another, and the third option, the third proposal was the media campaign. Now, unfortunately, we just have run out of time to do it in this financial year. According to accounting rules, and unless we've got the money spent in this financial year, then the money is actually lost to us. But I mean, I've given members a commitment that we will attempt to pick this up as early as possible in the new financial year.
And you're trying to convince me that there was no other alternative company out there that could have
This
done
more
it?
maybe can do with a short notice now, but
I know.
the money has to be spent within the next, 4 weeks?
Within the next 4 weeks.
And you only heard a short time ago?
We've probably done it in the best way possible, in the sense that it is an advertising agency that the PHA already does its business with. So I think to have gone to procurement would have just elongated the process even more. So it would have been the easiest and the quickest way to have done it, but unfortunately it is just not deliverable within this financial year.
I think we all agree, all of us agree that it's very disappointing that we missed out on that. But we can certainly understand as well, it was a very short time scale, and as you say, procurement might have made that time scale even longer. But it's very disappointing. But we'll look forward to you coming back in the not too distant future and telling us that that's going to be progressed again. Anything else, members?
That's the point I was going to ask.
Okay.
Will you come back to the committee again to keep us updated?
Absolutely. I think the time to do that is when there's a report made to the Minister every 6 months. We have indicated that we will then come back to committee at that point and provide you with the same update that has been provided to the Minister or Ministers, because there are a number of different ministers involved in this process.
Okay, members, is that everything? Thank you very much.
Thank you.
Thank you.
Thank you. Okay, members, if we can Move on then to item number 6 on the agenda, which is our forward work programme. Can I advise members that the Minister has advised that he will not be available next week to brief the committee on issues relating to the PPRS and the proposals for prescription charges. However, the committee is having a session with senior officials on the 11th of March to deal with the department's spending plans for 2015-16, and could we suggest that the committee could use this session to explore the department's proposals for use of the PPRS receipts for 2015 and possible funding mechanisms for a specialist medicines fund. Any comment on that? I know last week we had wanted the Minister to come in as soon as possible, but that's not possible at the moment. But I do think if we're getting the senior officials in, not the same officials we had the last time, that might be our opportunity if members are in agreement.
Given the Minister's personal circumstances as well, do we have a timescale when he will be able to present to us, or are we just making do with?
Not as yet. I wouldn't imagine if he could be here sooner rather than later. I don't imagine he would be running away from the committee in any way whatsoever. I do think that this is our second best option, is that the senior officials will be in. So I'd imagine that's Richard Pengelly and Judy and...
I would presume so.
Yeah, I presume so.
It is important, Chair, given the issues that were raised
Absolutely.
last week and the concerns. I think it was quite an emotional charged committee meeting, and there were certainly more questions than answers. So we do get the opportunity as soon as possible to drill down and find out.
Any other comments, members? No? Okay, if we could move on to item number 7, which is matters arising. And can I inform members there are 5 items under matters arising in the meeting folders? Can I ask members to note those items unless anyone has any comments? Okay, I've moved on to item number 8, which is correspondence. Can I inform members that there are 6 items of correspondence in the meeting folder. In the interest of time, can I draw your attention to several of those items? The first one is item 8.1 on page 80, and it's an update from the Department against Programme for Government Targets. I advise members that the committee will be taking evidence from officials on the Programme for Government in May, when the position for quarter ended 31st of March is known. Okay, members?
Yeah.
Item 8.6 on page 170 is further correspondence from an individual concerning the fire service. The committee agreed last week to advise the individual to contact the Public Accounts Committee on the matter. I know I certainly received the correspondence personally myself, and I know the Chair did also. I don't know if any other members did. So are members fine with that we advise on that? Okay.
Great.
Okay, members. Item 9, any other business?
Yeah, Chair. Sorry.
Yep, go ahead, Gary. Go on ahead.
Just to comment on, once again, the 12-hour wait, particularly in the Ulster Hospital. We just seem to be going from problem to problem, and it doesn't seem to be getting any better. And I mean, is this still as a result of the closure of the City Hospital? The reports that we heard over the media in recent days is that whilst the Ulster Hospital is in the South Eastern Trust, they are catering for a large percentage of people outside that trust, which takes in the Belfast Trust, which seems to be as a result of the closure some time ago, the temporary closure, by the way, of the City Hospital. And I don't know whether the committee can put under pressure on something or somebody to see a quick improvement, because it does seem to be ever-ending, never getting above the 12-hour wait.
I understand, and we were given a briefing a few weeks ago on how were looking at improvements on our ED system. So do we maybe need to get further information of what they're doing to improve that, how it has improved, if it has improved in any of the other trusts? I'm not saying that we need to bring them in here in front of us at this stage, because I think they very much have things that they need to get their own jobs to do and be getting on with their jobs, but maybe even some written clarification of how the EDs have performed since they were last in. Would that satisfy you on that point so far? because I think it's a very valid point.
The other thing is, I'm sure our members had correspondence in relation to the drastic reduction in finance for the Public Health Agency, and it was mentioned here by now I don't think it was because of the want of funding that, but the Public Health Agency has been cut by 15%, and we know that the Transforming Your Care document is talking about prevention, early detection, etc. And this huge reduction will have a drastic effect on that very topic, among other things, of course. Is there anything that the committee can do to try and get that huge reduction reduced?
I couldn't agree with you more. I believe the PHA plays a very important role, and we hear it all the time. We debate it all the time about prevention. And I mean, there are many things that the PHA do so successfully. And I'd have concerns about that as well. Catherine has just advised me that that is an issue that we could bring up on the 11th of March when the senior officials are in, which is only, what, 2 weeks away? So we will bring that up with them. Karen, if you're happy with that, when they're in 2 weeks' time, we'll raise the issue. When you can raise the issue when they're here. Okay. Is that okay? Because I do agree with you. Yeah. Very important. Okay. Extremely important.
Thanks very much, Chair.
Okay. Did anybody else want to come in under AOB? Nope. Okay. Members, my goodness, this is one of the quickest health committees I've ever been in. Item number 10 is date and time and place of next meeting. The next committee will be on Wednesday the 4th of March, starting at 2 p.m, again in this room 29. Thank you, members.
This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room